everyone. I'm Dr. Gargi Kandhari. I'm a dentist. I'm also the co-founder of Via Aesthetics. Today, I'm here to talk a little bit about root canal treatments. Well, the name itself instills fear in most of us, including all my patients. So one of the first questions I'm asked by most of my patients is it going to be painful? Will it hurt me? Well, the answer to that is no. If a root canal is done well, following all the protocols and adequate anesthesia has been administered, it does not have to be a painful treatment. Then who requires a root canal? So if you have a carious or a decayed tooth that is painful, is hurting you, that is a prime indication that you need to go ahead with this treatment. In such cases, just a filling will not suffice because the infection has already spread into the nerve. What will happen if I don't treat it? If you do not treat it, then the infection will spread further. From the nerve tissue, it goes to the root. From there, then it goes into the periapical region, that is the surrounding area of the tooth, and from there to the surrounding bone, and henceforth. The next question is, how many sittings will I need? Will I have to come repeatedly? Well, I prefer to finish most of my root canal treatments in a single sitting unless there's a specific indication like there's a draining abscess or sinus with lots of infection, swelling, and it's very painful for the patient. Most RCTs can be completed in a single sitting. The steps involved are, we first remove the carious or the decayed tooth structure. This is followed by a thorough cleansing or washing of the canals, which is of utmost importance because if we leave behind any kind of infected tissue, at a later stage it can result in reinfection and pain and sensitivity. This is followed by a good, well-sealed filling. If all these steps are followed, the pain or the discomfort is completely taken away. Another thing which is very important to consider following a root canal treatment is to get a post-endodontic restoration. What is that? That is a full coverage crown, especially for your back teeth like your molars, which are your chewing teeth. Because although the root canal will save your tooth, it makes the teeth a little brittle. Hence, to prevent any fracture of the tooth at a later stage, a crown is mandatory in the back teeth. However, in your front teeth, it can still be avoided if there is adequate tooth structure to support. Another treatment modality that is important is an intentional root canal or a deliberate RCT, wherein we do this treatment even when there is no infection. This is done in cases of a fractured tooth where we need to give a crown, or in aesthetic cases where there's a lot of gaps or spacing or crowding and the patient wants to correct his or her smile and we need to give full coverage crowns, we need to do the RCTs. Also in case of abutments for missing teeth and in case of hypersensitivity. So finally, I would just like to conclude by saying that if you have a tooth which has been hurting you for some time, please do not wait. Don't wait for it to get much worse. Go consult your dentist, and if a root canal is indicated, please go ahead and get it done. If you have any further queries or questions, please feel free to reach out to me. And if you like this video, please like and share it. Thank you.